In total, suicides have increased between 1999 and 2016 by about 25% nationally. South Dakota has seen that during that same time period, a 44.5% increase as well. 2016 is the latest data available for all states, and we rank 13th highest for our suicide rate. In 2017, we had the highest number of suicides ever recorded in the state, with 193 suicide deaths. One of the things that we do know about that is that older Americans are at greater risk for depression, especially after loss of someone that they've spent their life with. So that creates a huge amount of stress in their life and can predispose them to suicide risk. So in South Dakota, we do have rates that are 2.3 times higher among our American Indian population than we do our white-raced individuals. And some of our higher rates among counties have been among some of the more rural locations, number one, but also counties that are primarily American Indian. I think a lot of it comes down to social connectedness, stigmatization for individuals in a specific area. There are the social support network is not as well developed in some of those areas. And I think the other thing to remember is that suicides are multifactorial. It's not just one thing that leads a person to commit suicide. There are a lot of other factors. Going to a healthcare facility or trying to go to a healthcare facility for a mental health condition is just harder in rural locations because they're either not available or not as readily available. And so when you're traveling long distances on a regular basis, it can be difficult, number one, but it may also identify a person as seeking out mental health care. So we do have Suicide Prevention Awareness Month, which is September every year. So we're doing a lot around raising awareness in communities, trying to decrease the risk of stigma with reaching out and getting mental health care, as well as the Be the One SD campaign, which is targeted at our youth in terms of helping them know how to approach an individual who may be at risk of suicide, who may be having problems. And we also have the sdsuicideprevention.org website that has a lot of good information. It has county level information on suicide attempts and suicides. It also has information for prevention toolkits for specific populations, including teachers, American Indian population, the elderly, and so on.